dandruff with hair fall. Tell us the correlation between
There is
them.
absolutely no correlation. There is a magical shampoo somewhere, as the ads say so, and you use it and it's gonna go away.
And people lose confidence with hair loss.
Judges people at times, with the volume of hair they have.
You're saying that dandruff is
It's
actually
a fungus. It's a fungus.
that's
The
overgrown.
conventional dandruff, that's overgrowing. Yes, strong family history of baldness. Now, this is a condition which is genetic. The skin is lacking in some kind of a gene.
I've heard that 204 million people live with. Dr. Rahul.
Hi, Jatin.
Hi.
How are you?
Good. I've known you for a while now.
Yeah,
and it's such a pleasure to have you on Deep Talks and have very candid conversation about everything to do with skincare.
Yeah, same
Welcome.
here. Thank you for inviting me. I did went through your podcast and really felt the whole, aura and how we have the guest responding and their interviews really interesting.
I'm glad. I'm
So,
glad you like
thank
it.
you.
So let's begin.
Yeah.
Let's start with
Sure.
this condition that we call acne. And I hear that 230 million people are going through this condition globally.
Mhm.
But people still think this might be a pimple or two.
Yeah.
Right? And there's a lot of misconception about it. So
Yeah.
tell us a little bit about acne. There is adult acne.
Yeah.
So just break this down for us.
So the number 230 million, good that you emphasized, because people often might feel that acne is something which is, just a thing. We have to understand acne is a condition. We don't categorize as a disease. It's a chronic condition. So the word chronic here is very important. So we are not dealing with something acute or subacute that will probably go in few days or few weeks. It is basically seen mostly when a kid turns a teenager around
Right.
that puberty time because of the hormonal changes and all. For some predisposed children, we would notice that they start erupting, especially in the T-zone. So you might have the forehead covered with small black or white heads. You might have the nose covered and the nearby chin and the cheek areas.
Right.
Basic root problem is the overactivity of the sebaceous glands. So your face is studded with sebaceous glands. So when those glands are overactive, obviously they are going to grow, they are going to give out more oil, they are going to get infected because oil is a good media for bacteria. And when they get infected, you have the bigger pimples, which is the papules and the cyst, painful ones which are oozing. So we have to understand that this is a chronic condition and it has to be dealt in that way.
Right. So when you say chronic, describe chronic. Is chronic over 6 months of having a condition?
So chronic means something which can be there for more than 6 months, which can be there for more than a year, 5 years, 10 years.
So what is the minimum number for that?
6 months.
6 months, right?
months,
So anything, a condition that you are having in your body
Yes.
for over 6 months,
We consider that as
consider
a
that as
chronic
chronic.
condition. Exactly.
right?
So with acne, it is something that can last even a decade or even more than that. So
Right.
this we are talking of the teenage acne. But then we have another kind of acne, which is adult onset acne that happens after 25 years of age.
Okay.
So somebody who never had acne or never had teenage acne and they start erupting after 25 years of age. That is adult onset acne.
Right.
So in that also there could be an element of the teenage acne which didn't show then and now it is showing more, or it could be because of some hormonal disturbances. Especially in females, we would notice some eruptions happening after 25-30 years of age. So we might have to look into the hormone part of it and then manage it accordingly.
Right. But when you say it's a chronic condition, that means definitely it's not a temporary condition. And that changes everything. Just that thought, even mentally, oh, I have a chronic condition. How do you deal with that? And how someone facing this issue deals with this long-term problem?
Exactly. So most of the patients, when they're coming to you for the first time, teenagers would be there with the parents. So parents would be like, acnes are happening. It is something that happens in these years. And it is really aggressive in nature.
So again, they're thinking of a pimple or two.
Of a pimple or two, but those are aggressive. So my questions would be like, why do you think they have it?
Yeah.
That's my first question. Like, first thing that anybody should be knowing, why you're having it.
Right.
So then the usual suspects, come out of the closets,
Yeah.
not washing the face, not drinking enough water, not sleeping on time, not eating clean food, and so on.
Yeah.
But let me remind you, all these are very important. They do help us a lot in keeping the skin clean. But if somebody is predisposed to get acne, they would erupt. And when I say predisposed, I'm bringing in an element of genetics into the picture.
Right.
So that is something most of the people are not aware of it. That if genetically your skin is predisposed to have more number of sebaceous glands, bigger size of sebaceous glands, then no matter what you're doing, still the eruptions can happen. But again, I'm saying all these things have to be done correctly. Hydrate yourself, eat clean, sleep on time, all those things. But don't just rely on them that they would fix the whole problem.
Yeah. So this is
So
quite challenging, right? Like parents, you just mentioned parents come to you with kids, teenagers. In a teenager's mind, there is so much going on. Biologically, there are so many things changing, erupting at the same time. Your
yes,
mind
yes,
is changing, your bodies
yes,
are changing.
yes,
And then you have these acne, pimples, or whatever
yes,
you call it.
yes, yes.
How do you deal with situations like this, especially in the mind of these teenagers?
So basically, you just have to explain them that your skin needs a little bit more care than usually a person would do. It is just like caring for your teeth, brushing them twice a day, using a floss. That's one way of putting it. But at the same time, we have to tell them that your skin is a little acne prone. We might have to give you a skincare. A skincare is something that you can use in the long run. So it might consist of a good sunscreen, a good moisturizer, a good face wash, and some acne creams would be given to them. Benzoyl peroxide, salicylic acid, retinoids, and all those things. And we have to give them some kind of a consultation in the way that how to use these creams about. And just give them the confidence that this is not a lifelong thing. This is just a phase that we have to pass. And if we are not very keen on using these products, then acne might worse later on. And that might cause another thing that we are quite scared of as doctors. We call them as acne scarring.
Okay.
So that's a word I really put up in the first consultation itself. That please take your acne seriously, because bigger the acne is, it's invariably going to leave a mark on the skin. Now that mark could be a depression, could be a pit, could be a hole, or just a different color. So
That's enough motivation.
Those are
for
known as acne scars.
acne scars.
Bigger motivation for treating the acne is scars. Once they have developed, we can't completely eradicate them.
Right.
So you can't expect me that, doctor, I have some pits on the face, do something, they become flat. We do cosmetics, we do lasers, we do microneedlings, we do injectables. They all help in making your scars much, much better. But we can't expect them to completely eradicate completely.
Right.
So
right.
that's where the main motivation is. So when I start seeing them that they are really erupting in a way that they are going to scar, or they are scarring in the present, then I have to give them some kind of a treatment plan and tell them to follow it up regularly.
Now let's talk about dandruff, doctor. A lot of people think this is a hygiene issue. But I know we've had a discussion. You've told me it's more than that. Tell us a little bit about dandruff.
So dandruff, again, it is like you can just say, it's conventional dandruff that we are talking of. So it is just like the two faces of the same coin, acne and dandruff.
Right.
So basically, when your skin is on an oilier side, when the skin is oily on the scalp, mostly the fungus which commonly lives on our scalp will start overgrowing.
Right.
So there's a fungus, Pitrosporum. It commonly lives on all of our scalp. But when they find extra oil on the scalp, the fungus starts growing more and more.
Right.
When the fungus starts growing more and more, you'll see that white flaking which is coming off. Now that's a fungus. That's an oily scalp. Ironically, people feel it's a dry scalp and they will try to use more of oils and all that might further jeopardize the situation. So we have to make them understand it is not an hygiene issue. It is again something biological, again something more to do with the type of scalp skin that somebody has. And I always tell my patients, because they might be using an anti-dandruff shampoo and they would come back to me and I would ask them, no, doctor, it's not working. I'll ask them, the day you wash your head, is it better the day you don't? They say yes. Then I tell them it is working. Your expectations you have to lower down.
Right.
Your expectations are there is a magical shampoo somewhere, as the ads say so, that and you use it and it's gonna go away. It doesn't work like that.
Right.
If it is the dandruff that we are talking of, you have to use an anti-dandruff shampoo on a regular basis. Something that is not going to lead to hair loss, something that's not going to damage your hairs.
Right.
So that's the thing we have to understand. Hygiene is not an issue with the dandruff, but it is the scalp type which is oily, and then the environment and the pollution and other things makes it more prone for dandruff.
So yeah, because I've been always thinking that dandruff is that extra dead skin.
Yeah.
But you're saying that dandruff is
It's
actually
a fungus.
Fungus.
It's a fungus.
That's
Yeah.
overgrown.
The conventional dandruff, that's overgrowing, yes.
Wow.
The day you use an anti-dandruff shampoo, something like, let's say, the generic name ketoconazole or something like that, selenium sulfide, you know that it improves for a day or two and then it again comes back. But then there are grades of dandruff. It could be mild, moderate, severe. You might
Yeah.
have to do more than that. And there is a scalp eczema that also flakes, something like psoriasis we might discuss later. That also present with flaking, but that's different from the conventional dandruff.
Right. But where does dandruff normally come from, this fungus that's overgrown? Is it more genetic? Is it more the conditions you live in? Tell us about that.
So the fungus is commensal. It lives with us.
Yeah.
That's a fungus on everybody has it.
Yeah.
But when the fungus has more oil for its growth, then it starts outpouring from everywhere.
So it's an oily skin,
It's
basically.
an oily skin. Just like I said, the coin, one side is the oily skin on the face, shoulders, back will cause acne.
Right.
The oily skin on the scalp. So mostly kids will have dandruff and they will have acne.
Got it.
It's like that.
Right.
So we have to understand that it is more to do with your skin type rather than anything else.
Yeah. And a lot of people treat this with natural resources available at home, especially as Indian households, turmeric on head or yogurt on head or number of things like this, which are homemade remedies.
They've been doing it, but like I said, natural doesn't mean it's always good. It might be safe, but is it useful? Is it worthy of it? That we have our reservations there.
Right.
Medicated products, beyond doubt, has proven to be in studies shown that they really help. So when you're talking about dandruff, it's a fungus. You apply an antifungal shampoo and it's going to give you the results. You apply an antifungal spray, it's going to give you a result. All these products might not be having any scientific basis. And so I probably would be a little reluctant in
home remedies.
Them, yes.
So when you see all these adverts of anti-dandruff shampoos, they all have some antifungal properties in them?
Yes, they do. That's why you have patients coming back with the OTC brands available in the malls that we've been using this in this shampoo. Now they have ZPTO, that is zinc pyrethrone, that is an antifungal. So they have these milder antifungals that they have got in those shampoos. So those shampoos will also work. I'm not saying those won't work, but it should be meant for the fungus.
So now talking about dandruff, and we continue talking about that. We live in Dubai, and there's a lot of talk about the water in Dubai, which is hard, or people say GCC water is a bit hard.
Yeah.
What do you think of that? Does it cause more dandruff?
Hardness is there, no doubt, more calcium, magnesium salts, and you do expect dry skin to build up, not only on the scalp, but on the body also. So you do expect a bit of that dry skin. Now, this is the dry one that we're talking of, not the oily dandruff. So that dry flaking at times could be because of the hard water.
Right.
But like I said, hard water also is going to affect your skin big time. Your skin is going to be more dry, more flaky, especially people who have eczemas and bit more sensitive skin. They might face more difficulties with hardness of water.
Right. Yeah. And connecting dandruff with hair fall, tell us the correlation between them.
There is absolutely no correlation. So that's one thing people often confuse, that dandruff is leading to hair loss. Now that's a different matter. I mean, no matter how much a person has a dandruff on their scalp, it's not going to cause hair loss, what we usually see when patients are coming to you. So we have to tell them these are two different issues.
Now, hair loss is a real thing, Rod, and people lose confidence with hair loss. And I've seen a lot of people in their early 20s and 30s losing a lot of hair. So what is your one advice? What do you do when you start realizing you're losing your hair, with that losing your confidence? What is your one advice?
So unfortunately, I mean, it's a fact, society judges people at times, with the volume of hair they have, and it just works on a patient's mentality in that sense that they'll be more anxious and not in a right frame of mind when the hairs are not that much on the scalp. Hair loss in the 20s is not a rare phenomena. Let me tell you that very clearly. In fact, the primary hair loss that people are having is the genetic hair loss. Again, the genetics comes into the picture.
Right.
We have to bring it up again and again, but that's how things are. We have to be optimistic, but at the same time, we have to be realistic. That's what I tell all my patients, that I'm here to give you an option or a solution, but we also should know things. There's no harm in hiding the facts, So I might have a patient coming with their parents, 20 years old, young patient, and losing hairs. Parents are like, doctor, it might be because of some deficiencies, or it might be because of, XYZ things. I can clearly see that boy or a girl has a patterned hair loss. Now, patterned hair loss is a genetic hair loss. And we do see when there's a strong family history of baldness, the hair loss might come early. Even in teenage, you might notice that the thinning has happened from the frontal or from the vertex. Sometimes parents would say that our hairs are fine, but then that's not how the hair genetics works. It's not a vertical transmission. It's more like a horizontal transmission, how the roots are. So how a kid or a child gets their hair from, we never know. It's the father's family, mother's family, extended family. So first we have to make them understand. Most of the time I put the kid outside and then I just have a discussion with the parents that we might be dealing with patterned hair loss, genetic hair loss, and we do have some good options to at least curtail the loss what's happening.
Right.
We have a good lotion in the form of minoxidil that helps, plus few more treatments. At the same time, I would also like to do the blood test. There's no harm getting a vitamin D, B12, zinc, iron, and other vitamins checked up. But we don't have to put a lot of relevance to those tests. It's not like your vitamin D is low, that's why the hairs are getting lost left, right, and center. No. So equal amount of relevance that, okay, these are the deficiencies, you kindly continue these things. Then we have to see the patient for any other hormonal issues underneath. So if maybe it's a female patient, we might have to look for more than 30 years, we might have to look for any underlying hormonal issues, any thyroid issues, any autoimmune issues.
Yeah.
So all those things.
Yeah.
But the pattern gives us an idea where we are heading.
Right. And hair loss is such a serious thing, like we just discussed. It can cause a massive mental disturbance in someone. And a lot of products in the market right now that say that they can control hair loss. Over-the-counter medicines, tablets, shampoos. What are your thoughts on those?
So first we have to realize the reason. So like I said, if we are talking about a patterned hair loss, which is the most common kind of hair loss, for an adult 30 plus, hairs are getting thinned out. That's what we say, thinning of the hairs. And thinning can happen suddenly also. So 1 year, a person can start showing the thinning. So if we are talking about the patterned hair loss, then for men, usually when you're talking about the treatment plans, there's a thing known as an FDA approved.
Okay.
So from that perspective, only lotion that is FDA approved is minoxidil. Only tablet for men that is FDA approved belongs to 5-alpha reductase family, which is finasteride. The tablet do have its share of side effects. So we obviously talk to the patient before giving them. Minoxidil also we talk to them and before giving them. And we have to make them understand that this is a lifelong treatment plan. Patterned hair loss is not going anywhere. All these medicines are just delaying the inevitable. Any other product in the market are at best experimental. So a doctor might have more faith in one product because they might have seen the results. These products are cocktails of vitamins, minerals, hair growth factors. But if you talk about them working short, that is not the case. So we have to be very, very careful because it's a huge market for hair.
Yes.
Every month you will see a new range erupting. So we have to be very careful with that, that what we are using has some kind of a basis to it.
Yeah. So if someone's making 1 lakh rupees a month, say some urban professional in India, and is facing this hair loss issue and spending a lot of that money, probably going to Turkey or somewhere else, getting an implants, thinking of this.
Right.
What is your one suggestion to them? Where do they start? Go to a local doctor, first check what's really going on, do some blood test. Where do they start?
So basically 3 things are there. We have to understand the medical treatment, the surgical treatment, and in between bridging the injectables, we call it. So first is, what's the condition? Is it a pattern or a genetic hair loss, which is known as androgenetic alopecia, or something else?
Right.
If it is something else, that might have a fix. So there's a thing known as telogen effluvium, in which a person will come to you saying, doctor, I have lost quite a lot of hairs in last 1 month. Sudden hair loss.
Yeah.
Then you ask them a history. Were you unwell 2 months back, 3 months back? They said, yeah, we had a dengue or a malaria or whatever. Now, any sudden illness, physical or mental, can lead to a sudden hair loss. All of the hairs are recovered in a while after giving a basic treatment. So that one recoverable. Hormonal deficiencies, recoverable. Most of the time, what patients that we are seeing is for the thinning, which is the genetic hair loss. So we have to make them understand there are 3 things, male or females. Minoxidil is the cornerstone of treatment. People are often asking me this question every single time. They've heard about minoxidil a lot. So they will be asking me, doctor, what if we stop, will we lose all the hairs?
Right.
So my counter question is, if you see your hairs are growing and there is no side effect, why would you stop?
Right.
And then there's no answer. So we have to understand, we are treating a condition. We are treating a aging condition.
Yeah.
How do we expect it to stop completely? It won't. I mean, you have to keep using the products.
Yeah.
So one is minoxidil. Then there are some tablets we talked about, finasteride and all. But then you have to be aware of the side effects. So there might be a set of patients who might be right candidates and set who won't be right. So you have to manage them. Then there are some other sprays and all that a doctor might decide of giving it. On the other side of the spectrum is the hair transplant.
Yes.
Now, hair transplant is something which is permanent because the transplant surgeon is removing the hair which is not going to fall at any age, means the hair behind your ears. And they are placing the hairs right in the front where the deficiencies are. Now, hair transplant, there is no right or wrong timings for it. For someone at 25 years, moderate hair loss would be too much. For someone at 30 years, same thing. It's a person thing. If
Right.
you're feeling that I'm not confident and I'm having a moderate hair loss, you might go for a transplant. But always remember, the transplanted hairs don't fall. But those hairs which are already on the scalp today might fall after a few years. So the
Right.
density again would reduce.
Right.
Suppose you
right,
get
right.
transplant this year, 2025. By 2030, you will see that the density again is a bit less.
Right.
So transplantation has to be done if you have a good donor area 2 to 3 times maybe in your lifetime if you get that chance.
Right.
But don't expect the hairs to be fully, kind of completely set and you won't lose any. The transplanted hairs won't go, but the hairs that are there, that would fall.
Right.
So that's the other side of the spectrum. Meet the right doctor, meet the right clinic. Don't go by just the reviews. See the results. It's a thing that person has to be very realistic that depending on the donor, the results will come.
Right.
In between two, bridging these two, the medical treatment and the surgical treatment are the injectables. Now, the injectables are these injections, like a mesotherapy, you do it on the scalp. Primarily, if I get it from patient's blood, it is known as PRP, platelet-rich plasma.
Okay.
If I get it from outside, not patient's blood, then we call it as just the mesotherapy injections, which is a cocktail of stem cells, vitamins, minerals, XYZ. All these procedures we are doing in our clinic and many aesthetic centers are doing it. People are coming back. We are seeing the results. And that is probably the single most positive reason that you see that people are happy about it. You can notice that the hairs are growing and you can see a visible difference.
Right.
But at the same time, the flip side is that it is at the end an experimental therapy. So we can't say that it is something which is FDA approved and everybody will get the result. It's a individual based therapy.
Right. So one is hair transplant and the other is injectables.
Yeah. So hair transplant is a surgery.
Right.
You get your own hairs. They place the hairs and there will be a result.
Correct.
The injectables are the injections you're giving on the scalp, hoping that the follicles which are dying will start regrowing.
Right.
But
right.
it is a hope. Right. And we do see the results. It works very well. But we can't expect all the patients to show very good results.
Right. So with injectables, what is the ratio of results? Successful?
It's pretty good. Depends upon what kind of hair loss you're seeing, what therapy you have used. Have you used PRPs? Have you used exosomes? Depends on that. So results vary according to that. But decent to good results we are seeing in the clinics.
Right. But when you compare a hair transplant to injectables,
there's no comparison. Hair transplant is a surgery where they are placing your hairs from back of your head to the front. That hair will grow if they place it properly, and they will, a surgeon. So it's like a surgery. You're getting the hairs. I mean, there's 100% certainty that
hair will grow.
Hair will grow because that hair is alive hair that they're placing in the front. But all these injections, we are hoping that they will stimulate the hairs. It's
Fair
just
enough.
a hope.
I understand that. But then why would a person not go for a hair transplant when there's a guaranteed result?
Because transplant is a surgery and it is something that you can't do more than maybe 2 times or 3 times in your lifetime.
Right.
It's an expensive surgery. Injectables is like you can do it. We do 6 sessions every month. Every year, person can go for maintenance. If they're getting results, it's just a half an hour procedure.
Okay, I get that.
Transplant is heavily
and as the
expensive.
technology is getting better, as we all know in front of our eyes, things are changing every day. I think this technology of injectables will also improve. And sooner or later, we're going to see that hair loss will be a thing of the past.
Precisely. That's what the plan is. RCTs, randomized control trials, meta-analysis are going on behind these therapies, that how much they really are effective in nature. So we are hoping to get some good, more better results that can somehow guarantee the results.
So if in the future, if you see a bald man is out of choice, maybe.
Let's see. Let's hope for that future. Yeah, why not?
So Doc, moving on from hair to diet. We are what we eat, as the saying
Precisely,
goes. Tell us about the connection of eating right. What is this one superfood, if you may, that affects our skin in a very positive way, and one food that is not good for our skin?
So we have to understand the concept of free radicals and antioxidants. So anything which is an oxidant, anything which has a free radical element behind it is bad for us.
Okay.
And anything which has an antioxidant thing in it is good for us. So all those berries, cherries have full of antioxidants, the green leafy vegetables and all. So those are the things that really makes a good improvement as far as our skin is concerned. On the other hand, all the sugary food items, white bread and any kind of junk, processed soda or any kind of sugary food items is going to really hamper the skin in more than one ways. High sugar leads to high insulin. High insulin is something that there's a process known as glycation. Glycation is for the aging of the skin. So it binds your collagen, it binds your elastin, it promotes more wrinkling of the skin. And also, the sugar is also not good for the acne prone skin. So it will flare up your acnes. At the same time, lactose, especially the skimmed milk, that is also not good for the acne prone skin. So we always advise patients to be a little bit more cautious. They know the common culprits. I tell them, what's the common culprit? Everybody knows sugar. Junk, there's that. You have to curtail that because from an aging perspective, that is bad. But the good things, so-called, the skimmed milk, that should also be kind of taken up in less quantities and amounts.
Right. So berries, antioxidants.
Full of it, yeah.
So berry antioxidants, do you think is best to take them first thing in the morning, or any time of the day is okay?
Well, any time of the day is okay. I mean, there's a quantity you have to take, probably 100, 150 grams of berries, blackberries or any kind of berries you can take it. And it would probably not make a visible difference in the short run, but when you bring it in your lifestyle, it would really do.
Also, internet is full of these ads, social media, where they're promoting all different kind of milk. I don't know, there are 25,000 different kind of milk products,
yes.
almond milk, lactose free. Then there is coconut milk. So now you mentioned that dairy could also be a problem for people who have sensitive skin.
Yeah, especially the skimmed milk, the low-fat milk, the hormones and other things in the low-fat milk, that is more or less a problem for people having acne-prone skin. But I also try to tell them to just consume a little bit less of dairy. You know, usually yogurts and all are fine, but still, because I don't feel dairy to be very compatible with the skin, especially if it is an acne-prone skin. Other milks and all, oat milk and all is, I think, a better substitute as compared to this. And lactose-free oat milk, those are, I believe, if the taste obviously conquers to a patient's need, I think those are good alternatives. Yeah.
And sugar is in everything.
Sugar is the killer here. You know,
sugar is the killer. How do we manage sugar? Nearly everybody is facing some issue. Whether it's skin, diabetes. As a doctor, you meet tons and tons of patients.
So first we have to change the mentality. When you say don't consume sugar, so patients would just, before you finish the sentence, they'll say, no, we don't take sugar. Now for them, sugar mostly would be that white thing that is there in your kitchen. But that's not just sugar. Sugar is carbs, So when you say sugar, it is your roti, it is your bread. And so many things have sugar in them. So we have to really curtail those things. Fruits have a lot of sugar. So you have to be very careful consuming the fruits that you choose. You can't just have a bucket full of, let's say, grapes or, pomegranate, just, gorging them down. So there you have to be very careful. What you're eating is very important in that sense. Flour, which is not sugar-based, something like oat-based, and quinoa, and all these are very good alternative food items for the skin.
Right. And these supplements like collagen and biotin, are they really useful or just a big propaganda?
Say biotin, if you really do somebody's biotin, there's hardly any biotin deficiency.
Right.
Yeah. So suppose I get a patient who comes to me and I do their biotin might be fine. They might be deficient in B12, D and other things.
Right.
So biotin deficiency is not that common. So patients are consuming primarily biotin. I would advise them, get the blood check. Look out for other deficiencies that might be causing dryness and other issues with the skin and try to fix them. Collagen powders and all, the study says it's a very modest improvement. It's not like you consume it and the skin is just gonna be like free of scars and all. The improvement is not that much, which prompts me to kind of keep using them for a very long time.
Right. So let's have a chat about some cosmetic procedures now, Doc. There is Botox and fillers, and people use these terms interchangeably. So what is the main difference really between the two?
So both are very different. First, Botox is a brand.
Yeah.
The molecule is botulinum toxin.
Okay.
Now, this brand Botox is so famous that it has kind of replaced the procedure name. So everybody says Botox, Botox, Botox. But Botox is a brand. It's a very good brand from US. So both are very different actually. Very different means very different. Botox is meant for your dynamic wrinkles, dynamic lines. So when you are expressing your face, you might see some lines between your eyes, on the forehead, around the eye area, and also on the lower part of the face, and sometimes on the neck also you start seeing some lines. So Botox, it just makes your muscles, when you're injecting it, just makes them a little bit weaker. Okay, so don't take it in a wrong way that it makes it weaker, but the contraction of the muscle just reduces a bit. So when you're emoting, it doesn't show up much. The face doesn't look wrinkly.
Right.
And also, it is something for dynamic wrinkles. So suppose somebody choose not to do Botox. Many people don't. Now those dynamic wrinkles with age will turn into static lines. Static lines are when you're not expressing, you still can see the lines. Now for static lines, nothing works well.
Right.
Then you have wrinkles which are seen even at rest. So Botox is just a prevention, as in it is making sure that your face doesn't get wrinkled sooner. It's very safe to do, done with a good doctor, with a good product. And the good thing about Botox is it's not going to last for more than 4 to 6 months. So if somebody doesn't like it, you anyways are not going to have it after 4 to 6 months. On the other hand, filler, the word filler, you're filling it. So usually we talk about the face. With age, bone resorption happens.
Yeah.
The cheekbones and all, they are resorbed, under eyes comes up. So spaces happen and which doesn't look good. So there are fillers for the cheeks, there are fillers for the chin, there are fillers under eyes, there are fillers for the nasolabials. So when you fill the space, the face looks better contoured. And these fillers also last for 9 to 12 months, the temporary ones. And I mean, you can redo it. So Botox patient might come twice a year, filler patient might come once a year,
Right.
done with a good doctor. And so doctor is not going to overdo it or underdo it. First, we have to understand what the patient is looking for, how much they're looking to change. So you have to give patient a nice mirror and you have to ask them what are the 3 things you don't like about your skin, and then give them a proposal, a treatment.
Right.
So the results, sometimes patients are too scared of these procedures. They'll be like, we have seen the results, but then there might be a botched up procedure. So patient might have asked for something unrealistic.
Yeah.
So if done with safe hands, in right quantity, in a good aesthetic center, the results are good.
Right. So you mentioned that these procedures are safe, but again, there's a lot of talk about it. People generally probably are not educated, and people feel this could turn up to something really disastrous in the future as a side effect. Tell us about the safety. Obviously, it's evolved over time. Technology has changed things. Tell us how safe this entire Botox or fillers process is.
It's very safe actually, very, very safe, because doctors who are doing it has been knowing the anatomy of the face. They know where the muscles are, where the arteries are, where the veins are. So when they're doing it, chances of anything going remotely wrong is very low. I mean, anything can go wrong.
But that's with any procedure.
That's what I said, with any procedure. But the chances are very low with a good expertise doctor. But they give you this cushioning also that your face would not age that fast. So in good hands with a good quantity and understanding the doctor and the doctor understanding the patient need, we can get really good results. In that
so
sense.
it's just like, as you age, you take care of your body better. Whether it's vitamins, minerals, whether it's going for dental procedures.
Yes, exactly.
This is exactly like that. Another procedure which is...
Precisely, yeah. I mean, there's nothing wrong with it. There's no taboos with these procedures, There might be botched up images on internet and, maybe not done in a proper way at a proper center.
Or maybe overdone it.
Maybe overdone it. Patients might ask for more, So in that case, it will not look natural. So patients who are looking for some natural results, you can tell the doctor, we are looking for very subtle results. The doctor will put the product less in quantity at the right places. So safety-wise, very safe, just like any procedure is, but very, very fulfilling as far as results are concerned.
Right. And there's a lot of saying that once you start Botox or fillers, you can't stop. Is that a myth or reality?
It's a myth actually, because see, once you start Botox, obviously your wrinkles and all, they are very shallow. They are not very visible. Face looks quite young, quite rejuvenated. The skin tone and everything looks good. Same goes with filler. You have filled up the space, let's say under the eyes. It looks nice, less tired. Problem is when patients are not doing it, then it goes back to the same level. And their memory doesn't serve them right what it was before.
Right.
And then they're not happy with that fact that, oh, it looks worsened. No, it is not worse. It is probably the same level what you had. Plus, obviously, the age that you have caught up in last year or two. So there's no harm doing them once a year or whenever the doctor is asking you to. In that sense, yeah.
Right. Okay. Right. Doctor, moving on. I've heard that 204 million people live with eczema. What is eczema? Tell us a little bit about it. Everyone's talking about it. People suffer from it. Tell us about eczema.
So eczemas are of different type, but I would like to mainly emphasize the main one, which is also known as atopic eczema, atopic dermatitis.
Okay.
Now, this is a condition which is genetic, and patients might present to you at a tender age of 6 months or a year. Genetically, the skin is lacking in some kind of a gene. The name of the gene is filaggrin gene. There's some mutation of the gene. Because of that, the skin is hypersensitive.
Okay.
The barrier of the skin is dysfunctional. The barrier is not working in a way that it can keep the allergens and the irritants out.
Right.
Henceforth, the skin loses the ability to retain water, retain moisture. And this is a genetic condition. We have to make parents very much aware of it, that this might go away in few years, or it might take more than few years to settle down. Henceforth, a basic care is absolutely essential. So once the barrier is not functioning, means you need to do or give something for a barrier, and nothing better than a good medicated moisturizers. Now, moisturizers are something for eczemas which have elements in them, it will mimic the element what your barrier has. So it might have ceramides, it might have proteoglycans, it might have hyaluronic acid, it might have glycerine and other things. That's the foundation. And that's what I tell all my parents and my patients, that the foundation has to be absolutely strong. And the definition of foundation is the same anywhere. If your foundation is not strong, then everything will fall in place.
Right.
So a good moisturizer for patients suffering from eczema. Oil cannot replace a moisturizer. That also parents do very wrong at times, that they might be putting coconut oil or some other oil. Oil is nothing more than an emollient. It is just for the softening. In the oil, there is nothing to build the barrier.
Right.
So never replace. If you want to do the oiling, that's okay, but always moisturize the skin.
How do you know you have eczema? And is it also a fungal infection?
No, eczema, like I said, it is a genetic condition where your skin shows rashes on certain areas of the body. Those rashes could be red, could be dry, could be flaky, could be itchy, at times oozing. And kids often between the age of like over 6 months or 1 year of age will present to your clinic.
Right.
So depends on the age, the areas are affected differently. So like in a small kid, a parent might say that their cheek is very dry and flaky. As the kids grow, the folds starts getting affected. So in childhood eczema, any fold can have dryness, any fold can have cracks and itchy rashes. A fold could be a earlobe, a fold could be under the eye, a fold could be the cracked lips, a fold could be front of the elbow, behind the knee. So a kid or a patient will present with dry skin, redness, oozing at certain areas of the body. You diagnose it clinically, you might do some blood tests to make the diagnosis even more confirmed. And then the foundation, like I said, is laid with a good moisturizer, body wash, and you tell parents, if it's a minor kid, avoid the irritants. Now, you cannot 100% avoid it, but whatever minimum soaps, chemicals, sanitizers. Avoid that. Avoid bubble baths, hot water shower. When the kid is going out to play, make sure that they are covered their skin well so that they don't come in contact with grass, pollens that acts as big allergens at times.
And that's an important point you made, hot water showers, because that's normally inflates, whether it's a fungal infection, whether it's eczema.
So hot water, we all know, dries off the skin. So when you're taking a shower with a hot water, it dries off your skin. And eczema skin is anyways very dry and very irritated. So we often advise parents, lukewarm, cold you can't expect, but lukewarm shower. There are some soap-free cleansers, use those. And at home, try to give them the environment. A good air purifier would filter out the dust. A good air humidifier, because in Dubai, we face the problem of air conditioning. And air conditioning air is extremely dry. So you're sitting at home, you won't even realize 16 hours, lips are cracking, the skin is becoming dry. So people who have eczema, it's a bigger problem. So a air humidifier at home to control the humidity. And then when it is more, then you have some medicated creams. When it is even more, you have some tablets. And for the unfortunately the worst cases of eczema. Lately, we have some injections in the market which pretty much controls it.
Right.
I have used the word control, not cure, because eczema is again something that might stay with you for a while.
Right.
In that sense.
Right. Well, that's interesting. And stress. I know this is a non-stop loop. Stress causes breakouts. Breakout causes stress. How do you cut this chain?
It's a two-way street. Two-way traffic. You correctly pointed out eczema, acne, psoriasis, all these somehow are related with stress. So people would often say that when they are under stress, kids during the exams, the eczemas will flare up. And vice versa. When you have eczemas, you're stressed. You don't feel good about your skin. So we have to obviously work towards that mental part of it. We advise parents and patients to just take care of their skin, stay calm, stay relaxed. And if need arises, maybe if they need a consultation with someone who can manage their stress, we also at times do that.
Right. And Doctor, talking about skincare, taking it further, a lot of us going out in Dubai or anywhere in the world, we use sunscreens. And we use them. Obviously, there are sunscreen products for kids, specially made for them. And sometimes when I'm applying sunscreen to my kids and to myself, I have a question mark in my head. Are these harming me in some way? Tell us about that.
So thanks we brought up this topic, because sunscreen is a very, very important and a relevant discussion I want to have. So single most important skincare for any individual, without even a shadow of doubt, is a sunscreen. Single most important. How somebody is gonna age boils down to 3 factors according to me. One, your genetics. We say that, you have a very good skin and, that thing. Second is your habits, type A personality, addictions, how you have led throughout the years. And the third thing that really decides how you're going to age is your cumulative sun exposure. Now, here the keyword is cumulative. Like somebody is keeping a diary, noting that this month your exposure was this, last month it was this, and before that it was this. So the cumulative sun exposure. Sun does a lot of things on our skin, depending on the skin type. For more lighter skin tones, the Caucasian skin, obviously we are aware of the skin cancers and, the malignancy part of it. Even in our skin, the sun exposure is gonna cause over time a lot of pigmentation issues, which might be at times permanent, melasma and others. It might cause a lot of wrinkles to come up. That might not be visible in the early 20s or early 30s. But by the time it hits you, like the realization, why am I having so much of wrinkles and textural changes on the skin? The sun has been doing the damage. Now, most people I meet, sunscreen, I don't need it, doctor. I don't go out. Now, who goes out in the sun? So mostly people, 9 to 5 or whatever the job is, we are not exposing, but then still that slight exposure is enough to cause the damage. Slight exposure is walking from parking to home, from parking to office, grocery down, up, windows, picking up the kids on the weekends, going out, open areas. So you have to use a sunscreen. I tell my patients, don't take it as a burden, take it as a care.
No way. So you're saying use sunscreen every single day. It's not only when you're going to the beach.
Unless you're living in a room like this. So suppose if I have to spend my day in a closed room, I will not use a sunscreen. But obviously, nobody is doing that. You have windows, nobody is aware of this very important factor, that sunscreen results are not shown in weeks, months, but in years. When you start using it, then you notice it hasn't deteriorated that much. Over 1 year of age, I would recommend parents to start using the sunscreen. And when you are going to the beach or pools, you have to do it more often.
Thank you.
Another thing that people often are not very happy about sunscreen is that it gives a white cast. It doesn't go well with my skin. It burns my skin. There are so many sunscreens in the market. You have to choose. There's one definitely available for you.
Right.
I'm 100% sure. That you have to, mix and match and see. But please start using a sunscreen. It's the single most important anti-aging cream you can ever use.
That's changed my perspective. It's a massive information. And so, Doc, final question. If you could give one advice to someone in their 20s who are looking after their skin or thinking how to best look after their skin, what would that be?
So one is stress-free. Try to manage your stress levels. Difficult because there's nothing to measure stress as such, but try to be stress-free, eat healthy, hydrate your skin. try to do a little meditation, yoga, exercises, they release cortisol in your blood, and that's very good for the skin. It's like an antioxidant. So that is one thing. About the skincare, I've already emphasized about sunscreen. Find the best sunscreen for yourself. It might take time about the consistency. And then a good cleanser to clean your skin, unclog the pores. Again, that you have to meet your dermatologist about what kind of skin you have. And a good moisturizer.
Right.
Again, for the barrier building. You have to build the barrier, otherwise the barrier is exposed to heat and dust and other things. So these are the three most important skincare. Sunscreen every day in the morning, a moisturizer depending on your skin type, and a good cleanser. And then whatever else you're doing is an add-on. Like vitamin C serum, yes, why not? It is an antioxidant. It can be done with the sunscreen in the morning. Hyaluronic acid, why not? Yeah, it's a good hydrating thing. It really plumps up your skin. Niacinamide, why not? It's a very good molecule for controlling the acne, blemishes, pigmentation. And retinoids, why not? After a certain age, especially in the 30s, when you start noticing that the skin is getting a little open-pored and pigmentation, there are retinol creams, which are very good anti-aging creams. So we need to set up some kind of a skincare. More is not good. We have to understand that. It's not like you need to have 10 things on your shelf. You'll be confused. Reactions will happen on the skin. Financially doesn't make sense. Less products and the turnover. So you have to, discarding a product, wait 3 months. Unless it is reacting.
Right.
Wait 3 months. Skin cycle is 4 weeks. The skin turnover time is 4 weeks.
Right.
At least give 3 cycles before deciding it's not helping me or whatever. But all these have very subtle benefits. Like the benefits are big, but the subtle changes are there. Like sunscreen is not going to show any changes in months, but you have to keep it for years.
Okay, so this is great information, doctor. I think if one thing I'm taking from this podcast is that skincare is not just vanity.
Yeah, exactly.
It's a way of life.
Yeah.
Eat well,
Yeah.
stress less,
Yeah,
take care of yourself, and get your sunscreen.
Yeah, that's the most important thing I could say that, Jatin. Yeah.
Thank you so much for being here today.
Most welcome. Thank you for the invitation.
Thank you.
Glad.